guys, and welcome back to my channel. My name is Chloe if you are new here, and if you are, I would love for you to hit that bright subscribe button down below. And of course, if you enjoy the video, don't forget to give it a big thumbs up. So as many of you will know, I'm currently training to be a mental health nurse, and I'm due to qualify in July, which is equal parts terrifying and exciting. I have attended 3 interviews for jobs as a graduate nurse, and I am very fortunate that I have received job offers from all 3 of those interviews, which I was quite surprised by, and now I'm faced with the dilemma of actually deciding where I want to work. But I thought I'd take this opportunity to share with you guys my tips for interviews. I've done quite a few videos about nursing before, so I know a lot of people that follow me are either already training to be a nurse or are hoping to be a nurse in the very near future. I'm actually partnering with a website called Nurses.co.uk for this video, and I can't even believe that I'm saying that. I already wanted to create a video like this, so when they reached out to me, it seemed like the perfect partnership. And because the people at nurses.co.uk know how nerve-wracking interviews can be, they have actually produced a handy little guide that you guys can download off their website, which is full of top tips for nursing interviews. And I just think that's such a great idea, because if you're like me, I can do loads of preparation and I feel really good about something, and then the second I sit outside that door waiting to go in for that interview, my mind just goes blank. I'll pop the link to this in the description bar so you can go and check it out for yourself. But I think it's just such a great idea to either have it on your phone or print it out. That way you can use it while you're actually preparing for your interview, but then also as that final bit of reassurance right before you walk in the door. So as I said, I'll pop the link to that in the description bar so you can go and download it, check it out, and I will pop the link to their website there as well, because they've got loads of other handy articles on their website. Now, I have been quite lucky because my 3 interviews were all completely different. I went to a preceptorship event, I then had a typical panel interview, and then I also attended an assessment day. So I thought I'd start off by telling you a little bit about all 3 of them and how it kind of worked, and then I'll give you my advice for interviews after that. I'll start off by talking about the preceptorship event. And for anyone who hasn't heard about these, they're kind of like job fairs for sort of soon to qualify nurses. And basically there are loads of different staff there, loads of different students, and there's quite often like little stands or stalls, and each area or ward will have kind of like their own little space, and you can kind of wander around, chat to people, and really get a feel for the place that you might be working in. These kind of events are such a great idea if you're not 100% sure what area you want to work in when you qualify, because as I said, you can talk to loads of different people. So you could go and talk to a ward and say, I'm interested in working here, and they can give you a little bit more information to help you make your decision. You obviously don't need to decide right then and there, but they will ask you to kind of rank your preferences. So once you've done all the paperwork, they'll give you a time for like a mini interview, and normally you'll just go into one of the side rooms near to the preceptorship event for about 15 minutes and kind of just have an informal one-on-one chat with someone sort of quite senior, like a manager. It feels a lot more like an informal chat, kind of like a get to know you, as opposed to like a formal interview. So it's a lot less intimidating, a lot less scary, and if you're someone that normally falls apart in interviews because you really panic, then one of these preceptorship events might be a great idea for you, because it is a lot more informal, a lot more chilled. Like, I didn't feel like I was at an interview at all. Another great thing about preceptorship events is that a lot of the trusts that hold these will quite often offer to pay your first year's fees of the NMC if you get a job offer that day. I can't remember how much the annual fee is, but I think it's over £100. So if the trust wants to pay it for you, that is definitely a benefit. So as I already mentioned, I also had a panel interview, and this is kind of like what I think of as like a typical interview. So it was myself, 3 members of staff, and then a current patient was also there as well, which I thought is a really great idea, because at the end of the day, they're going to know what they want to see from a nurse. You won't find this in every trust or on every ward, but some of them do it, and I think it's a great idea. In my case, I was asked 7 questions, and I think kind of about 7 to 10 is kind of the typical. You can almost guarantee that the first one is going to be quite a personal question. So normally, why do you want to be a nurse? Why do you want to work on this ward? What skills do you have that makes you think you'd be good at this job? That kind of thing. So it's a chance for you to talk about yourself and be like, hey, I'm great, please give me a job. I know it can be quite difficult to do that sometimes, but at the end of the day, you're in an interview, you need to toot your own horn. I was also asked a couple of scenario-based questions, nothing sort of ridiculously complicated, and nothing that's like so far-fetched you would have never come across it before. They are normally quite broad scenarios that are quite common in the area that you might be working in. One question I was asked in my panel interview that really threw me is I was asked to describe equality and diversity, And it's such an easy thing, like I know what it is, but in an interview setting, I just completely panicked and I started rambling and not actually answering their question, and I actually had to kind of stop myself and be like, right, start again. Sometimes I think the simplest questions are the hardest to answer. And then most recently I attended an assessment day. So this was a bit of a shock to me because, as I said, my first interview was like 15 minutes, the other one was about half an hour, and then this literally went on from 9:30 until I think it's about 3:30 when I left. So we started off the day with 2 assessments. The first thing was a 20-minute multiple choice kind of exam, I guess you could call it. And the questions were a mix of drug calculations and then kind of questions that required you to have some sort of basic nursing knowledge. Again, it was nothing too complicated. You just had to think about it and not make silly mistakes. And you didn't have to get 100% to pass, you only needed to get 80%. So there's room for some, you know, small mistakes. After that, I was given a case study and 40 minutes to write a care plan to help address some of the risk issues that were talked about in the case study. So again, nothing really complicated, nothing that you will have never come across before. And although we couldn't see the marking criteria, on the front there was a little box for the marker to fill in and it literally just said safe or unsafe. So that was the key thing for me. I needed to make sure that my care plan would help to keep the person safe. Then our exams were taken away and obviously very quickly marked, and during that time we had kind of like a question and answer session with the Deputy Director of Nursing. They showed us a few promotional videos and it was kind of like, look how great we are, come and work for our trust. And then after all of that kind of schmoozing, they kind of came in the room and they'd call out names and you'd go over and chat with someone and they'd either tell you, you know, you weren't successful and they'd tell you how to go about reapplying to do it again, or if you were successful, they gave you an interview time to come back later and have a typical panel interview. So as I said, all very different interview experiences. As far as I'm aware, those are the main ways that they hire newly qualified nurses. I haven't heard about anything completely different from that. Now to move on to my actual advice for the interviews. The first thing, and this is going to seem ridiculously obvious, but dress smart. Dress like you're going to an interview. You would not believe the amount of people that I saw wearing like trainers, jeans, like jumpers instead of shirts. For me, I would rather be dressed too smart than not smart enough. So I would always go to an interview wearing trousers, a shirt, a blazer, and then proper shoes, not like trainers. I was actually chatting to a ward manager about it recently and she said you would not believe the number of people that turn up to interviews like just dressed sloppily, and it does not look good at all. It looks like you haven't put in the effort, and if you aren't making the effort, then are you going to be a good nurse? My next tip is to turn up early. Not on time, early, because you never know what might happen. For starters, you might get lost. If you're going somewhere that you've never been before, it's so easy to get lost, and you don't want to turn up late simply because you couldn't find the place. Plus, you might get there and find that they're running early or the person in front of you hasn't shown up, and it's just going to look really good if you're sat there ready to go. It looks awful if you turn up late. So I would rather be half an hour early and just sit there and read a book than even risk turning up late. A great way to prepare yourself for interviews is to familiarise yourself with the job description. A lot of the adverts will include quite specific information about what they're looking for in a candidate. So one of my interviews, for example, it said in the job description, we're looking for someone that goes the extra mile. So what you want to kind of do is answer the questions in a way that shows them you are exactly the kind of person they are looking for, even if they don't specifically ask you that. So for example, in that interview, I spoke about a specific patient that I had worked with and said that I had done X, Y, and Z for them, and it really helped them because it enabled them to do this. And I think they really appreciated the fact that I went the extra mile to help them. So what I've done there is I've shown them that I meet the criteria that they quite clearly said in the advert they were looking for. Often in interviews, they're looking for just a few key things that they want to pick up to know that you're the right candidate. So if you read the job description and the advert really thoroughly, you're going to know exactly what they're looking for, and you can try and show them that you are that person. The same goes for researching the trust's values. All trusts will have specific things that they identify are really important to them as a service. So what you want to do is show that your values are in line with their values and that you're going to make a great employee for that trust. Another way you can prepare for an interview is to kind of think about a few stock scenarios that you can throw out there and give examples. As I said, I'm one of those people that in interviews, my mind just goes completely blank. So I like to rehearse kind of a couple of different scenarios that I can talk about in interviews. Generally, you want to think of two scenarios. One where you did something really, really well, and then one where you maybe didn't do something as well, or in hindsight you would do something differently, or you really learned something from it. For example, I was asked the question, can you tell us about a time when you really made a difference to a patient's day? And it doesn't have to be a really complicated example. I just spoke about a young lady that I was working with who was having a really, really difficult day. And when she's struggling, she really kind of shuts down. So she doesn't communicate and she finds it really difficult to tell you what's going on, and just, you can't get anything out of her. But I know that she's a big tea drinker like me, and I know exactly how she drinks her tea. So what I did was, even though she didn't ask for it, I just went and made her a cup of tea and put it next to her on her bedside, and then gave her a bit of space in her room. And about an hour later, she came up to me and just gave me a massive hug and said thank you. Because even though I hadn't actually fixed anything, I hadn't made anything better, I think just showing her that I cared enough to do that without her even asking meant a lot to her. You know, it was a tiny little thing, but it made her day better, so that's why I used that in that scenario. The other kind of stock scenario that I use is, there was a girl that I was working with, and I'm not going to go into masses of detail, but she was really struggling. You know, she was really, really distressed. And initially I coped with the situation really well because I gave her things to keep her distracted, you know, things that I knew she really liked. So she loved to colour and draw, so I got her some pens and some pencils, and we sat and just drew silly pictures together. However, things started to escalate, things got a lot worse, and in hindsight what I wish I'd done is I wish I'd asked someone to come and support me earlier, because I think if someone would have come and helped me, the situation wouldn't have got as bad as it did. You know, maybe we could have done something and stopped it getting that bad if I'd have asked someone to come and help me sooner. So if you have a similar scenario, then it's great to use something like that, because it shows that you are aware of your strengths, aware of the things that you're not as good at, and you're able to reflect on that and learn from it, which is a really, really key skill for nurses to have. Another really important thing to do is don't overthink things. They aren't expecting you to know absolutely everything or tell them something so innovative they've never heard of it before or never thought of it before. No matter what the scenario is, as a band 5 nurse, the key things you need to be doing are asking for help, informing someone more senior than you, follow the appropriate procedures and policies, and then document everything after the situation's finished. You don't even need to know the ins or outs of policies, just say that you would refer to them to know exactly what to do. So I was given the scenario of a patient reporting that a member of staff had assaulted them, and one of the things I mentioned in my answer was that I would refer to safeguarding policies, and that was a good enough answer. I didn't need to tell them exactly what the safeguarding policy said. They don't expect you to know the policies inside out, they just want you to know which policy to go and check to resolve that situation. Another tip for scenario-based questions is to stick to the right now. Don't think about the future, just what would you do immediately after that situation has happened. So one of the scenarios I was given is, a patient is self-harming, what do you do? Very, very simple, very straightforward. What you don't want to do in that situation is start talking about referring them for CBT, teaching them distraction techniques or grounding techniques, or preparing them a self-soothe box. Those are all great ideas, but actually in that moment that someone is self-harming, you wouldn't do that. That will be something you do in the future. They just want to know how you would immediately deal with an emergency situation. You might get scenarios that are slightly more complicated than that and kind of have like 2 or 3 elements to them. And in that case, I would always ask for either the interviewer to repeat the question so that you can make sure you've really understood it, or I would kind of rephrase it and kind of say it back to them and just check that I have understood all of the key elements of the scenario, because you don't want to miss something out. But if you do miss something, they'll usually help you out and just kind of say, oh, and what about, you know, that thing? For example, I was given a question that sort of had 3 parts to it. They asked me to explain a particular situation, I can't remember what it was now, and then say what I'd done well and what I would do differently with hindsight. And in my answer, I only really talked about what happened and what I could have done better. So once I'd finished talking, the woman sort of said, and what about the things that you did well? You know, she prompted me to answer the bit of the question that I'd kind of overlooked. You know, the people conducting these interviews aren't monsters. They're not trying to catch you out. They want to hire you. So generally I find that if you haven't quite given them the answer they're looking for, they'll kind of give you a bit of a helping hand to sort of understand what they're looking for. Another really important thing to do is to think of a few questions to actually ask the interviewers themselves, because at the end of every interview I have been asked, you know, do you have any questions for me? A good one is to ask about sort of potential career development paths. or, you know, the possibility of going on to do further studies, because this shows that you are ambitious, but also that you're planning on staying in the trust, which is something they want. They don't want to hire someone that's going to leave a year later. But if you're asking about things like doing further development with them, then it shows you want to stay. A couple of easy go-to questions are also to ask about their preceptorship program, you know, how it works, what the time frame is. And you can also ask about things like shift patterns if you're applying to work in somewhere that you didn't train. These are just easy kind of go-to questions if you really can't think of something. But it's always better to try and ask something that maybe other people wouldn't have asked, or something that shows that you've done your research. So one of the places that I applied to is currently running a pilot program whereby CAMs, sort of children, when they turn 18, they don't have to transition straight into adult services. They can stay with their CAMs team until they're about 25. So what that means is if at 18 they're really, really struggling, you know, now's not a good time for them, they don't have to then, on top of all the issues they're already facing, get to know a completely different mental health team. It means that at any point between turning 18 and 25, whenever they're in a good point in their lives, they can transition then, when they're a bit more stable and they're feeling up to it. And I think this is an amazing idea, because I think 18 is often a terrible time to transition people, because so much in their life is changing and they haven't got that person that they've been working with for sometimes a few years to kind of support them through all the other changes they're experiencing. So when they asked me in the interview if I had any questions, I asked them about this pilot study. How is it going? Are they seeing good results? Have the young people found it helpful? Because this shows that I'm really keen, I've been doing my research, and I want to know more. So that is everything that I wanted to cover in this video. But if you have any more questions, feel free to leave them in the comments down below, or you can private message me on other forms of social media. Both my Twitter and Instagram are always linked in the description bar. Don't forget to download the guide that Nurses.co.uk have put together for you guys. And as I said, just check out their website in general, because they have got loads of really fabulous resources on there, as well as lots of job opportunities, which I'm guessing if you're watching this video, you might be quite keen to know about. Don't forget to give this video a big thumbs up if you enjoyed it, and I will see you again next time.